You're listening to Intelligent Medicine, a resource to help you take control of your health. We offer a balanced, objective analysis of all your health, wellness, and aging options, both conventional and alternative. Now you can take your engagement to the next level by joining FullScript. FullScript is my online dispensing platform that only offers curated, professional-grade supplement brands that I know and trust. Never counterfeit or expired, always stored and shipped correctly. Just go to drhoffmanstore.com for more information and to start your free FullScript account. Buying through FullScript offers fast, free shipping, optional refill reminders, a mobile-friendly site. It's safe, secure, and HIPAA compliant and offers world-class support. Just go to drhoffmanstore.com. You'll get access to the supplements and features you need to help you achieve your wellness goals, including my custom targeted protocols that combine the products I recommend to address specific needs, heart health, immune support, and much more. It's all at drhoffmanstore.com. drhoffmanstore.com.
Welcome to Leyla Muedin here on the Intelligent Medicine podcast. Thanks for joining me. Thanks for downloading these podcasts. If you'd like to email me questions or topics of interest that you'd like to hear me weigh in on, take a deep dive on, questions@drhoffman.net. questions@drhoffman.net. In addition, I want to talk to you today about vitamin K2 supplementation and its importance, because apparently it slows coronary artery calcification. This is in a 2-year clinical trial that was just published in the Journal of the American Medical Association Cardiology by researchers based at Maastricht University Medical Center in the Netherlands. Daily supplementation with 360 micrograms of MK7, which is menaquinone 7, which is a form of vitamin K2, slowed the progression of coronary artery calcification in a cohort of individuals with confirmed atherosclerotic cardiovascular disease. Now, all 180 patients in this study were at elevated risk for heart attack and had a baseline coronary artery calcification, that's a CAC score, between 50 and 100 Agatston units, between 50 and 400 Agatston units, AU, based on how they looked at 128 slice multiple detector CT scans. This is how they do a coronary artery calcification scores, and the scoring is called Agatston units, which is AU. So coronary artery calcification, CAC, score between 50 and 100 AU based on these scans. So compared with those on placebo, the patients who consistently took the vitamin K2 supplement showed a 29% lower CAC progression over the 2-year period based on the AU, the Agatston score, and 42% less progression in arterial calcium mass. Quote, this randomized clinical trial found that supplementation with vitamin MK7 has the potential to reduce new coronary artery calcification in people with mild coronary disease. This is relevant because it's an inexpensive and safe product that can be easily purchased. And according to researchers, the nutraceutical ingredient that provided the MK7 for the study, they say it's remarkable as we currently do not have any effective treatments to address the issue of vascular calcification. So nutraceutical companies are absolutely on this, keeping an eye on this as well. It's a modest but a meaningful effect. And the authors characterize the overall impact of supplementation as modest, adding that it remains to be seen whether taking MK7 over an extended period would reduce actual fatal and non-fatal cardiovascular events like heart attack. At the outset of the study, 78% of the patients were taking statin drugs, and 67 to 74% were smokers. So think about that. 78% were on statin drugs, which we know causes calcification. I'm going to get into that in a moment. And 67 to 74%, nearly 3/4 of the participants were smokers. Wow. The authors note that these points are important when assessing CAC outcomes because statins are known to promote calcification and raise CAC scores. Let me say that again. You did not mishear me say that. The authors, these researchers note that these points are important. 78% of patients were taking statin drugs. Why is this important? They say it's important when assessing CAC outcomes because statins are known to promote calcification and raise CAC scores. Active and past smokers are also at risk of increased CAC progression compared with never smokers. We know that smoking does this. It increases the progression of coronary artery calcium. But so do statins. So think about this. The statin you're taking, and I've talked about this in previous podcasts. What the statin does, how it works, is if you have soft plaque, the soft plaque is more dangerous than calcified plaque. What the statin does is it calcifies any soft plaque because calcified plaque is more stable, less likely to break off, cause a clot, cause an infarct, cause a heart attack, cause a stroke, etc. Getting back to this study. Many of the participants were also taking ACE inhibitors, beta blockers, calcium channel blockers, and or diuretics because roughly 2/3 had been diagnosed with hypertension. And that would be the reason for these particular drugs like ACE inhibitors, beta blockers, calcium channel blockers, and diuretics. So the 180 men and women were randomized to two groups. One took once daily oral tablets containing 360 micrograms of MK7, and the other took placebo tablets, which were similar in size, shape, and color. The 360 microgram dose level was based on data from previous human clinical studies. The researchers evaluated the patients at 6, 12, and 24 months, measuring serum vitamin K status and capturing repeated CT scans to quantify CAC, to quantify coronary artery calcification. They estimated full compliance with the MK7 intervention to be 80% over the 2-year stretch. Okay. Now, among those taking the supplements, plasma levels of MK7 rose from a median of 0.5 micrograms per liter at baseline to 6.56 micrograms per liter by the second year. Not surprisingly, MK7 levels remained flat at just over zero among those on placebo. So let's talk about attenuating progression. MK7 supplementation did not avert CAC progression. AU scores rose steadily in both groups over the 2-year trial period. But the acceleration was far greater in the placebo group. The median CAC score among the placebo-treated patients went from 145 AU at baseline to 173 AU after the first year, and continued rising to 214 AU by the close of the study. So they say, the researchers say, quote, "This randomized clinical trial found that supplementation with vitamin MK7 has the potential to reduce new coronary artery calcification in people with mild coronary disease." Now, in contrast, AU scores among those taking MK7 were 135 AU at the outset, 150 AU after year 1, and 184 AU by year 2. Now, they say that that's a 14% difference between the two groups. The researchers say, irrespective of what scale was used, all generalized imaging equations analyses showed that the evolution of the CAC score over time was significantly less in the active treatment group compared with the placebo group. They add that the yearly increase in CAC scores was reduced by 19 AU among the MK7 subjects. Calcium mass scores showed the same pattern. Though the scores increased in both groups, the MK7 group showed consistently lower calcium mass measurements at year 1 and year 2 compared with those on placebo. The Maastricht researchers note that at baseline, all subjects had visible coronary plaques, but that, in most cases, these caused only mild stenosis. None had life-threatening plaques. So let's talk about the impact on stenosis. MK7 supplementation did appear to mitigate the increase in stenosis severity over time. The researchers reported that 41% of the patients in the placebo group showed increases in stenosis severity over the 2 years, compared with just 33% of those taking MK7. However, this difference was not statistically significant, but the observed increases in CAC scores over time did correlate significantly with increases in the number of previously non-calcified plaques that became partially calcified. The research team hypothesizes that MK7 slows calcification in newly developing plaques, but has little effect on already calcified plaques. Let's talk about improving elasticity. The notion that vitamin K2 might attenuate CAC arose from research showing that inhibition of the vitamin K cycle by vitamin K antagonists results in elevation of uncarboxylated matrix GLA protein, and this is strongly associated with arterial calcification. The chairman of the Department of Biochemistry at Maastricht Research Institute, who participated in the study, had previously reported that supplementation with vitamin K2 as MK7 could improve vitamin K-dependent MGP activation, which in turn reduces arterial stiffness and increases elasticity. There's also evidence from a placebo-controlled study of 165 peri- and postmenopausal women that the improvements in arterial elasticity following MK7 supplementation led to clinically meaningful improvements in blood pressure. The observations from this trial support the hypothesis that MK7 can mitigate CAC to some degree. Quote, as both the Agatston and the calcium mass score pointed in the same direction, we are confident that MK7 can slow down coronary calcification. But they also stress that the overall clinical impact of this intervention remains to be determined in future studies. MK7 is definitely promising, as well as being inexpensive, easily accessible, and very safe, but the authors urge caution against overly enthusiastic interpretations of the current data. So, are any of you still scratching your heads about statins causing more coronary artery calcification, and that's how they work? Because what usually happens after you visit your doctor and they send you for a CAC and they find some mild calcification, say it's a 50 or 57 or a 60 or a 90, and they want to immediately put you on Lipitor or Crestor or something, right? They say in an effort to slow down the progression, but what's actually happening is it's promoting more calcification from any soft plaques, which then brings to light more of the idea of, is it enough just to get a CAC, a coronary artery calcification score? Or is it worth it to go get a Clearly test? It's a very expensive test which looks for soft calcification. So soft coronary arterial plaque, soft. They say the soft is more dangerous. Maybe that's where we should be looking. So it's interesting. And you've heard me talk in the past when it comes to the statin medications, besides it reducing CoQ10. Many of you already know that. Many of you who take a statin take CoQ10, as well you should. But it can exacerbate sarcopenia, which is the diminishing of muscle as we get older. So there are many, side effects to taking a statin. Certainly if you've had a heart attack, you should likely be on a statin, right? But a lot of people are being given statin for primary prevention, meaning you've not had a cardiac event, you've not had a stroke, you've not had a heart attack, you've not had anything. You went to the doctor did blood tests, looked at your lipid profile and said your cholesterol's too high, you need a statin. That's all that happened. And now suddenly you're taking a statin. So don't be surprised if now you've been taking a statin for a while that you may see more CAC, a higher CAC than you had previously. But according to this research, taking vitamin K2 in the form of MK7 may help with that, may help mitigate that. And over the years, we've always recommended that you take 180 micrograms. Maybe it's time to bump it up to 360. And these researchers here at Maastricht University, they got this number from previous research, from previous clinical trials and things. So maybe 360 micrograms would be the way to go. Many people are already taking 360. They're seeing better, because if you're taking a calcium supplement, you want to make sure you're getting K. If you're taking a vitamin D supplement, you want to make sure you're getting K, because the K is what is driving the calcium back to the bones. You don't want it hanging out in the circulation where it may cause arterial plaque. You don't want it hanging out in the circulation where it may be deposited into soft tissue like breast tissue and look like, suspicious calcifications. That's the last thing you want. So, this is very interesting. You may want to consider then taking appropriate doses of vitamin K2 in the form of MK7, along with the vitamin D you're already taking, the magnesium you're already taking, following a lower carb diet, all of the things. And a qualified nutritionist can help guide you in this regard. I want to thank you for joining me on another edition of Leyla Weighs In. This is Intelligent Medicine.
I want to thank you for listening to the Intelligent Medicine Podcast. Follow us on Apple Podcasts, Spotify, Amazon Music, or your favorite podcast app, and get new episodes automatically downloaded every weekday. And please give us a rating and review. It truly helps new people discover intelligent medicine. The Intelligent Medicine Podcast is for general informational purposes only and does not constitute the practice of medicine, nursing, or other professional healthcare services, including the giving of medical advice, and no doctor-patient relationship is formed. The use of information on this podcast or materials linked from this podcast is at the user's own risk. The content of this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Users should not disregard or delay in obtaining medical advice for any medical condition they may have and should seek the assistance of their healthcare professionals for any such conditions. Finally, please visit drhoffman.com and discover everything Intelligent Medicine has to offer, including frequently updated, unbiased health news and fully vetted product and supplement recommendations.
This is Leyla Muedin, registered dietitian nutritionist. I maintain a private practice and see patients regularly. If you require a nutrition consult with me but live out of town, there's no need to travel to New York City. I have telephone and telehealth consultations with clients from all over the country. Please visit drhoffman.com for more information. And to set up an appointment, call 212-779-1744. That's 212-779-1744. I look forward to being a collaborator in your healthcare.